Hi everyone, my name is Asa Damang and my student ID is 2032678. Today I will be presenting the case study of Mrs. Teresa Manalo, a 72-year-old woman experiencing embolic stroke. This presentation includes reviewing her case using A2 assessment, highlighting four nursing intervention, and covering the three critical medication, Altipace, heparin infusion, and metoprolol 50 mg with evidence based throughout this presentation. So, beginning with the A2E assessment. The structured method guarantees a methodical diagnosis of life-threatening condition and guides the priority settings of care. Starting a Hudson Marks that delivers 6 liters of oxygen per minute, as Hudson Marks delivers high concentrated oxygen rather than nasal bronchs. Her oxygen sat is 95%, which is in line with the ideal level to sustain sufficient brain oxygenation. However, there's a significant chance of airway blockage due to decreased level of consciousness, GCS of 12 out of 15, and slur speech. Stroke increases the risk of aspiration because it often affects the cranial nerves and involved in swallowing. Airway equipment and suction must be near the patient bedside, and nurses monitor any sign of deterioration. Following that, under breathing, her respiratory rate is 26 breaths per minute. Shallow respiration indicating neurological fatigue. Strokes might impact the respiratory in the brainstream, making patient particularly vulnerable to hypoventilation and hypoxia. Although Mrs. Manilow's oxygen sat is within the acceptable range, cerebral might develop if it falls below 95%. So ventilation can be optimized and aspiration can be avoided by keeping the patient on oxygen treatment and placing them in a semi to high floral position. So, in terms of circulation, her blood pressure is 170 over 95 mmHg, and her heart rate is 132 beats per minute, and irregular because of arterial fibrillation. This result shows hypertension and trichyarrhythmia. Both of these raise the likelihood of both more embolic occurrences. Although hypertension can act as a compensatory mechanism to brain refuse, it needs to be carefully controlled to avoid hemorrhage conversion as well. Given to her cold extremities and delayed capillary refill, which points to impaired cardiac output, the nurse has to evaluate peripheral perfusion. Under disability, the neurological impairment associated with an embolic stroke, most likely affecting the right middle cerebral artery, is confirmed by Mrs. Manolo GCS 12 out of 15. Left-sided weakness, facial drop, and slurred speech. So, important neurological assessment should be made every hour using GCS assessment and highlights the prompt acceleration and prevention of subsequent damage are made possible by early detection of neurological deterioration. So, for exposure, Mrs. Manalo is afebrile with no physical wounds or bleeding. However, because of her decreased mobility and use of heparin, she is susceptible to infection and pressure injuries. Secondary problems can be avoided with routine in IV site inspections, reposition, and preserving normothermia. Now, I will be highlighting four priorities nursing intervention. The initial nursing intervention is to ensure airway patency and proper oxygenation. By placing Mrs. Manalo in a semi-floral position, the danger of aspiration is decreased and ventilation is improved. To support cerebral oxygenation, additional oxygen should be kept oxygen sat above 95%. The best practice recommendation for acute stroke include frequent suctioning and making sure the airway is clean. Hanan U 2021 indicates a sustained oxygenation enhance and survival and aids in stroke patient reoccupation. For my second nursing intervention, I will be discussing about continuous neurological examination. Early decline is detected by pupil check, limb movement, and hourly GCS. So, according to Mattel 2024, effective neurological monitoring facilitates prompt identification of intracranial pressure changes, which enhance the result of recovery and reporting and decrease in GCS or deteriorating weakness, right right once is necessary, since the symptoms might indicate hemorrhage transition or reocclusion. So, for my third nursing intervention, I will be discussing about hemodynamic and cardiac monitoring. As a regular blood pressure and continuous telemetry cardiac monitoring are crucial given by tricardia and AF. So according to Brady 2021, hemodynamic instability might worsen ischemia and lower cerebral perfusion, while heart rate regulation with metoprolol stabilizes rhythm and lowers cardiac strain. Nurses will monitor for adverse side effects like bleeding, bradycardia, and hypotension. So moving on to for the fourth nursing intervention, I will be discussing about early cooperation with the multidisciplinary team for stroke management. This discusses occupational therapy, speech pathology, physiotherapy, and stroke team as well. Early interdisciplinary engagement promotes early mobilization, shortens her hospital stays, and improve recovery as well. Safe handover and continuity of care are guaranteed by effective communication implementing the ESBAR framework. For question number 2, which is about pharmaceutical management, I will go over three important medication with an emphasis in nursing intabulation, administration concern, and side effects. So, according to Janet 2021, Altiplase, the first-line thrombotic for acute ischemic stroke, is primarily used to break up the brain clot and restore blood flow. Considering the Mrs. Manolo is inside the thrombosis eligibility window is the first step in providing care. Recombinant protein allergies should also be evaluated since they can result in uncommon hypersensitivity events such as rash of bronchospasm. So in order to administer Altiplase, 0.9 mg per kg up to 90 mg must be given. 10% must be given as quick bolus over 1 minute, and the remaining 10% must be administered over an hour. So reperfusion might produce erythematous. Thus, this crucial to monitor heart constantly. The potential risk of systematic and intracerebral hemorrhage is the main adverse effect as well. So moving on to heparin. Heparin is recommended for Mrs. Teresa Manalo, who have atrial fibrillation in order to lower her risk of embolism by blocking coagulation factors and preventing thrombus formation as well. Assessment involves evaluating the activated partial thromboplastin time every 6 hours and monitoring any indication of bleeding, bruising, hematuria, and allergic reaction or sudden platelet drips. Before administering Altiplase, heparin must be stopped in order to prevent an elevated risk of cerebral hemorrhage as well. So to prevent hematomas, intermuscular injections should be avoided, and IV sites should be alternated, and proper monitoring and caution management establishes coagulation and lower risks to recurrent stroke or systematic embolism. So lastly, according to her assessment, she has hypertension and trichocardia associated with AF, which are managed with metoprolol, a beta-1 selective blocker. It lowers myocardial demand for oxygen, stabilizes rhythm, and stops new clot formation by reducing heart rate and blood pressure. Heart rate and blood pressure must be checked before administration. If heart rate is less than 60 beats per minute, the medication should be stopped. To lessen gastrointestinal discomfort, it's thought to be good, used for meals and fatigue, dizziness, hypertension, and bicardia are the typical adverse effects of metoprolol. So, in conclusion, Mrs. Teresa Manolo embolic stroke demonstrate the complexity of caring for acute neurological and cardiovascular disease. Nurses play an important role in preserving oxygenation, cerebral perfusion, fostering recovery through rapid evaluation, continuous monitoring, and evidence-based pharmacological care, ensuring safe and patient-centered results. Thank you.